It's a chart review of 12 cases. Case 1 is a patient that complains of chest pain, hyperventilation, and tachycardia. Patient states she was at home just watching TV when she had a sudden onset of tachycardia, hyperventilation, and chest pain. She described her chest pain as sharp in nature with left shoulder pain, does not get better or worse with movement, and 9 out of 10. Patient states she did not have this happen to her before. She was driven by a family member to our station here in KL at 5, where the family states that the patient looked about the same when the symptoms first started. This is approximately 15 minutes prior to patient contact. Patient also describes numbness and tingling to the hands and states that the symptoms subsided throughout transport. Patient denied recent falls, injuries, or illness. Our assessment: patient with tachycardia, heart rate 130 to 140, 12 leads showing a sinus tach on the monitor, blood pressure 150 over 100, O2 sat is 94. Entitled is 11 millimeters mercury, and it improved to, I guess it says 23. Deck stick was 96. The lung sounds are clear and equal bilaterally. Treatment: monitor vitals, hyperventilation, coaching. All right, there is a lot going on here. We definitely want to find out what started first. Was it pain? Was it the palpitations? Was it the hyperventilation? Was there any type of triggering to this onset? Because what we're trying to tease out is whether or not this is really more of an anxiety attack, or is this really maybe a medical or a cardiac type case where the tachycardia is present. In any event, we do have some red flags, and so as we kind of take a look at our vital signs, heart rate at 130 and 140, that's quite elevated. We want to make sure we find out what's the cause of that. Is that because of fear, anxiety, pain, sepsis, maybe stimulated by medications or illicit substances? And it's good that they did the 12 lead, but it doesn't show us exactly what else is on the 12 lead or what it said. The pressure is good. It's a 150 over 100, and that should be up because the heart rate's maintaining that cardiac output. But we want to make sure that we test this patient on orthostatics to see whether or not we have any volume loss or volume changes. It does seem that the person is hyperventilating with some of the symptoms, but we just don't get everything here. We don't get everything as far as a true picture of what's going on. And you can tell the end title of this person has been blowing off the CO2 quite high because it's dropped here. And then apparently coaching has brought it a little bit closer to our normal range, but nowhere near it. And the lung sounds are apparently clear. That makes it good. That doesn't mean that that's not a respiratory case or anything. Um, as far as documentation goes, we definitely need to add more information into what are we dealing with here. You know, what was the trigger? What symptoms came first? And as we had this numbness and tingling to the hands and feet, was this or the hands? Is this really carpal tunnel spasms? Um, just not. It's a good start. We got some ways to go.